Good evening again. Our chief guest, Dr. Alaka Singh, WHO Representative Sri Lanka, guest of honor, Professor Senaka Rajapaksa, Director of the Postgraduate Institute, Dr. Sunil Dialvis, Additional Secretary to the Ministry of Health, and Dr. Champika Vikramsinghe, and other official guests of the Ministry of Health, former President of the Sri Lanka College of Psychiatrists, my council members, distinguished guests, ladies and gentlemen. First of all, I wish to thank our colleagues, members of the Sri Lanka College of Psychiatrists, for bestowing on us the honor of leading the association. I am extremely humbled to serve you as the president, and even more grateful that I will be working alongside a team of highly enthusiastic and dependable colleagues in psychiatry in Sri Lanka. Meanwhile, I would also like to thank the former president of the Sri Lanka College of Psychiatrists and his team for their effort and dedication over the past 2 years. Ladies and gentlemen, Sri Lanka College of Psychiatrists was established in 2003 with the noble aims of promoting the interest of the professionals in psychiatry and improving the mental health in Sri Lanka as a means of upgrade of the previous Sri Lanka Psychiatrists Association. Since then, Sri Lanka College of Psychiatry has come a long way. Notable achievements over the years include advocacy on policymaking into the Ministry of Health, a strong tradition of teaching, the creation of dynamic and resilient local and international collaborations in research, publication, programming, and the development of clinical mentorship, all the while establishing a system of professional development. Then very recently, I am proud to announce with the Ministry of Health, we managed to launch its mental health policy for the 2020 to 2030. That's a great development. I'm very thankful to the Ministry of Health official and the Minister for taking up mental health to the forefront after a long time. While these achievements are being attained, there exists more opportunity to consolidate these gains and the energy to reach more. It is unfortunate reality that mental health has been taking a backseat in Sri Lanka healthcare system for a long period. It is rarely, if ever, given priority and hardly talked about. There is no separate allocated budget for mental health in Sri Lanka. Furthermore, psychiatrists have long been fighting a battle to change the archaic Mental Health Act that we are still using, which has been in effect for over 125 years and the last amended in the year of 1956. Suffice it to say, the existing Mental Health Act does not adequately reflect the present needs and circumstances regarding the mental health in Sri Lanka. At the same time, there have been many unseen issues and technical difficulties in bringing forward a new Mental Health Act, which should address the current socio-cultural realities of the people suffering with mental illnesses as well as the general public. Moreover, we are lagging way behind in terms of mental health literacy. Mental health is yet to be incorporated into the educational system. Mental well-being, no. Mental health is not discussed adequately in the school curricula. Mental health or behavioral sciences are not a subject even in secondary or tertiary level education systems, other than the medical school. Most of the doctors in this audience may recall that even medical education often focuses on the clinical illnesses in psychiatry, but does not give enough emphasis to mental well-being or the behavioral psychology. It is needless to mention that we are navigating through difficult times. It well emphasized by the previous speakers that our previous president went through very tough time. But I think I am entering more difficult times and unprecedented times because of the financial crisis and lack of medicines. And daily I am actually handling about 40 to 50 calls per day on behalf of psychiatrists. It is not a secret, so this economic crisis is going from worse to nowhere. Although the impact of the economic crisis is being widely discussed, that unfortunately is only the tip of the iceberg. These numerous adversities have paved the way for unfavorable social, economic, geopolitical, and environmental circumstances, including poverty, violence, inequity, and environmental deprivation. These socioeconomic disadvantages increases people's risk of capitulating and falling into mental health conditions. Our public is now constantly struggling with economic, social, and existential issues and have difficulty managing their day-to-day life affairs. This has huge ramifications on mental health of the public. On this background, it is not surprising to note increase in behavioral disorders, substance use, school refusals, truancy, and conduct disorders among young people. In the context of economic failures, there is an escalation in aggressive behaviors in the community, relationship problems, problematic sexual issues, and gender-based violence. Minority and marginalized groups are further discriminated against. A recent island-wide survey done by us revealed that a significant proportion of mental health care workers have witnessed an increased presentation of depressive and anxiety disorders during the recent COVID pandemic and the subsequent post-COVID times. More alarming developments are likely to happen in future, along with lost opportunities and frustration with regard to income losses. Financial restraints are already affecting service provision to the patients who are seeking mental health support and care throughout the countries. It can be also anticipated that migration and brain drain will also affect the mental health services delivery substantially in the not so distant future. So we must also keep in mind that opportunistic parties and people with vested interest may take these advantages of the lack of awareness in the society about mental health and exploit those with mental health issues or socially marginalized groups for personal materialistic gains. Nevertheless, I am sure you would agree that Sri Lankans are extremely resilient people. We have faced numerous challenges in our history and battled through them. Resilience, however, is not without its cost. Some adversities can leave a long-lasting negative impact on our psyche. Some may carry the burden of this impact through their lives. Therefore, it is important for us as mental health professionals to handle these issues proactively, creating deep awareness and bringing mental health to the forefront. I believe it is important for the college to embark on this mammoth task with a clear vision and a plan. Our vision of the new council is to make Sri Lanka College of Psychiatry the leader in mental health awareness, advocacy, and service development with outstanding value for Sri Lanka. The mission of the current college has numerous dimensions: promoting excellent mental health services for Sri Lanka, training outstanding psychiatrists, setting standards and guidance while being the voice of mental health services of Sri Lanka, safeguard the interest and development of our fellow members, promoting preventive aspect in psychiatry, promoting quality and research, working with patients, carers and care organization, and also developing training forums, young psychiatrist forums, and mentoring people who are working in faraway places in Sri Lanka and who are entering psychiatric services straight away from their training. And we also believe that formal college in addressing mental health needs of medical professionals is a dire need. Furthermore, Sri Lanka College of Psychiatrists' mission and vision includes ensuring doctors sustain good performance. Their implementation should be experienced and encouraging and enabling. Moreover, those who conduct appraisals, identify training needs, and provide continuing professional development and training must be sufficiently skilled to ensure that these activities benefit patient care rather than simply meet academic or administrative requirements. So I have mentioned, ladies and gentlemen, large number of objectives in our mission, but it's not going to be easy task. So we have planned and intend to carry out the above mentioned objectives in a novel way. And this novel way I have named based on a concept developed by economists as strategic engines that will deliver our vision and mission to the nation. It consists of the president and the council who will be mainly responsible for organizing and monitoring all the activities of the other subcommittees, and we are then planning to develop a public awareness and a media committee, advocacy and a policy development committee, a legal and forensic subcommittee, old age subcommittee, a child Youth and Maternal Mental Health Subcommittee, and Continuous Professional Development and Welfare Subcommittee. And for the first time in the history of the College of Psychiatrists, we have former trustees of the college. We have named and appointed and confirmed 5 trustees on behalf of the college. I'll be introducing those trustees because the trustees are important. They are experienced psychiatrists who have held important academic as well as leadership posts in the college. So we have a lot of guidance and principles to learn from them whenever there's a contentious issues. So then I would like to introduce our members of the college who are pioneering and leading these subcommittees. First of all, I'm honored to introduce our Vice President, Dr. T. Gadambanathan, then our enthusiastic, highly committed, energetic Secretary, Dr. Sairu Perera, our past President, Dr. Gihan Abewardhan, with his experience, will be continuing to work with us, sharing his experience gathered during the most difficult times. Then I'm pleased to introduce our President-elect, Dr. Sajeewan Amarasinghe. Then Dr. Dulangi Dahanayaka is our Assistant Secretary. Dr. Chamara Vijayasinghe is our Treasurer. Dr. Malshada Silva is our Assistant Treasurer. Dr. Rumi Ruban is actually our Public Relations Officer, and we are expecting him to play a major role because in our new council, we are planning to reach to the community and create more awareness about mental health literacy in the future. Then Professor Aruni Hapangama, our editor. Professor Madhubhashini Dayabandara is our other editor. Then Dr. Dasanti Yakmeeman, who is an experienced psychiatrist who had worked in numerous forums in psychiatry, is a council member. We are honored to have experience as individuals as council member. Then Dr. Prabhat Vikrama, again a very experienced psychiatrist, is working together with us as a council member. Dr. Anuradha Ellapala from Anuradhapura district, representing peripheral psychiatrist, is working with us. Then Dr. Nipuna Ranavira, immediately after getting board certified, is putting a lot of young blood to our organization. Then again, Dr. Prabhat, T.S. Prabhat is a very young psychiatrist, joined us with us to go this handle with us in these difficult times. Then I am proud to announce the veteran psychiatrists who are with us as trustees. There are no Dr. Jayan Mendes is one of the first trustees we have nominated and confirmed with that. I'm sure his wisdom and experience will be shared with us in guiding the college. Then Dr. Ranil Abesinghe, again a veteran teacher and experienced psychiatrist in the trustees. Dr. Damananda Silla, one of my dear teachers and experience who had been silenced, I managed to get her into the trustees. Thank you, madam, for joining us. And again, Professor Harishchandra Gambira, again a veteran psychiatrist who had been contributing to the development of psychiatry in many domains in Sri Lanka. Then last, Dr. D.P. Vijayasinghe, again a senior psychiatrist who are retired, is joining as a trustee. I should say some special words about the trustees because this is not a new concept. Our college constitution actually recommends to have trustees, mainly to have them whenever the college go into crisis or financial situations to guide us, especially regarding policy and development issues and financial issues. So that's the end of the list of our council members and trustees. Coming back to the topic, ladies and gentlemen, in any given moment, we have two options. In psychiatry, that is very relevant, I think. To step forward into growth or to step back into safety. You all know it was quoted from the work of famous psychologist Abraham Maslow. However, The Sri Lanka College of Psychiatrists only sees to go forward into growth of mental health services. And I invite all the parties and individuals in this forum and who are listening to us through social media to join with us, to work with us for the betterment of psychiatry and development of mental health services in Sri Lanka. Thank you very much.